I just want to give a warm welcome to everyone who's joining this online public forum today entitled Pandemic, Protesting and Policing. It's being hosted by the Toronto East branch of the International Socialists. My name is Faylene Beaubier. I'm a member of the Toronto East branch of the IS, and I'll be chairing the meeting today. So as we begin today's meeting, first of all, I'd like to acknowledge that we're coming together today from our homes in places all across Turtle Island. In honoring the ability to gather, we recognize the First Nations, Métis, and Inuit peoples who have inhabited and cared for this land for many millennia. Wherever you live on Turtle Island, we are all treaty people who give gratitude to Indigenous peoples for their wisdom and strength in how we look after each other and the land. Part of each of our reconciliation efforts compels us to know and understand our colonialist history, the devastating destruction that it has caused, and the ways it continues to damage the lives of many. Just recently, May 5th, Indigenous groups from across the country held grieving ceremonies on Wednesday to remember the nearly 1,200 missing and murdered Indigenous women and girls in Canada. Women in Canada who are connected to this movement were questioning why their social media post disappeared on a day that was meant to raise awareness for the issue. And Emily Henderson, who's a Toronto-based Inuk arts and culture writer, wrote this: a bunch of content exclusively relating to missing and murdered Indigenous women and girls has just gone missing overnight. So this erasure of acts of solidarity with missing and murdered Indigenous women and girls is part of the ongoing oppression and erasure that we have to fight against and resist, offering active solidarity with Indigenous people. So a couple of points before we start. We'll be recording the speakers portion of the meeting today. And I'm going to go on to introduce our panelists and what the discussion will be about. Only a year ago, politicians were falling over themselves applauding healthcare and other essential workers for the risks that they take doing their work. When these same workers stand up for measures that would provide decent and safe working conditions and effective COVID policies, they are attacked by employers and governments who continue to put profits before people's lives. Essential workers have been at the forefront of fighting for more effective and more just policies to tackle the pandemic, including fighting for paid sick days for workers with COVID symptoms. So I'd like to introduce our three speakers today and just say how pleased we are to have an international panel. COVID is an international problem, and we need solidarity across national lines to solve the pandemic. So we're very happy to have these three healthcare workers speaking today, as they are representative of the millions of workers around the world who are fighting to keep us safe on a daily basis. So I'm going to introduce the speakers in the order that they will speak. Each person will have about 12 to 15 minutes, and then we'll open it up for discussion, for questions and comments from people who are here today. Our first speaker will be Karen Reissman, who's a healthcare worker from Manchester, England, who was fined £10,000, which is about $20,000, for leading a safe outdoor protest against a very insulting pay offer. Our second speaker, Kostas Katarachias, a doctor and president of the Workers' Union at a cancer hospital in Athens, who lost his job for union activity and who recently, happily, won reinstatement after a mass campaign. And our final speaker will be Sung-lim Kang, who's a public health worker and a socialist living in Toronto. So without further ado, I'll hand it over to Karen.
Thank you very much, Valian, and thanks very much for inviting me today to speak at your meeting. I want to talk a little bit about Britain before the pandemic, when we'd had 10 years of what we call over here austerity, where we have a Tory government that had massively reduced public services, massively cut wages and terms and conditions and benefits for ordinary people. The gap between rich and poor was getting wider. They were frequent users of scapegoating and discrimination in order to justify what they were doing. And it got to the point where, for the first time in our history, life expectancy had started to go down in some areas of Britain rather than continuing to go up. And that was an indication, and that was pre-COVID, not during COVID. And then we got COVID. And what COVID did was exposed and increased those inequalities even further. So we had more deaths, and those deaths were disproportionately amongst poorer people, amongst older people, amongst disabled people, amongst Black and Asian people, amongst the very people who'd been at the rough end of austerity before that. And the context, we have a Tory government that then used the private sector to consistently look after what they were doing in terms of profits. And we have private companies in Britain who have made an absolute fortune out of the pandemic and the contracts that have been given to them. Often they're actually friends and family of our leading politicians who've won contracts. And because of that, we have some of the highest death rates in the world per head of population in Britain. And so alongside those failings of COVID, there was also been a failing of the market. So we've had one of the biggest hits in terms of our economy as well. And that's not a surprise. The worse they are at dealing with COVID, even though they want to maintain profitability, actually the worse the impact that's been on the market. And that's not inevitable. It is possible for you to have a decent strategy over COVID and to have very few deaths. There are countries around the world who have done that: Australia, New Zealand, South Korea, Thailand, etc. But Britain definitely isn't one of them. And one of the consequences for us is that the pandemic itself, COVID, the infection, when they do fail, which they have here in Britain, they then have to resort to the worst case, which is lockdown, where we end up being locked down in our house, and you have to completely isolate people. Lots of people can't work, etc., in order to try and bring the level of infection down. And what that does is that actually limits our ability to protest. The very thing that we need to do to be collective in order to oppose what they're doing, the pandemic makes it harder to do because of what they do. But despite that, the anger has been here in Britain, that sort of, that people were faced with a choice of either allowing the government to carry on killing us, carry on impoverishing us. And some of the proposals where people were, at one point they were proposing sort of, £95 if you were laid off work because of COVID or you were isolating. And that means people were taking a massive hit on their income. But even people who were put on furlough were often, there were talk of, at one point, of only offering 60%. And there were protests in order to bump that back up. And I think that started, really, the first protests they had were ones that we did in the health service, where we were increasingly in intensive care units and in COVID wards, finding that we were nursing our colleagues. So you ended up, I remember talking to one ICU worker, and she was saying she's only supposed to have one patient. She had 4 patients because we were so overwhelmed. And she was saying that she had a nurse, she had a domestic, she had a home care worker, and she had the mum of a nurse in her 4-bedded bay. And you just think that anger that was generating when we didn't have the right personal protection equipment because the contracts had gone to private companies who were useless and people were dying as a result, meant we did feel like we had no option but to do protests. And how we did that was trying to make them safe. So we did do the social distancing. We held banners between us, so the banners were 2 meters so that you had to stand 2 meters apart. We had sort of very spaced out. We were outdoors, and more the evidence is that the transmission, because it's primarily done through aerosol, through breathing, that if you're outdoors, because your breath gets blown away, actually there's virtually no super spreader events of outdoor events whatsoever across the world. almost all of them, even if they involve an element of outdoor, also involve an element of indoor, and they believe it's the indoor elements that have led to the super spreading events. So we had the NHS protests, which did put the government under real pressure. Later on, we had the protests over NHS pay. In the first year, they offered health workers not a penny extra. They gave extras to some other workers, but not to health workers, which really, really angered people. But there are also the Black Lives Matter, because we also saw a disproportionate number of Black and Asian people in our hospitals. And really, again, it was quite shocking to those people who worked in the health service, where suddenly you had wards where half the faces there were Black or brown. And you just think there is something significantly wrong. And there's been research since that shows that that's to do with racism. And in that context, when people saw George Floyd being murdered so brutally on that video by somebody who clearly did not treat him as a human being, it exploded in anger despite the pandemic. In Britain, we reckon that we had 2 million people out on the streets over the course of the next few weeks. And we hope that we played a part in changing the whole narrative over racism, where it's not possible. There's somebody who's in court at the moment in Britain who was killed by the police 6 years ago, hasn't had any publicity until it's got to court this time, because it happened 6 years ago when they didn't publicise those sort of things. And so things have changed. Sadly, we have an opposition in Britain of the Labour Party who are more interested in criticising the left than the right, and the trade union leaders haven't done much better either, with the exception of the education workers, who really have sort of made quite massive progress during the pandemic of organising big mass meetings on Zoom, 20,000 members, 6,000 new reps as a result of the activity, which twice has stopped the government, who were reopening schools, from being able to do that by the action that they've taken. But I think one of the things that's clear is that, in a way, that we have a Labour government, we have a Tory government, the Labour opposition is useless, so useless that despite what's happened with the pandemic, despite the deaths, despite the impoverishment that we've seen, because we now have a vaccine that seems to be working and the numbers are going down and we look like we're returning to normal. The Tories have just recently won the elections that we had here on Thursday. And I think the government know the only thing they have to be frightened of at the moment is protest. And that's why they brought in a law which effectively consolidates some of the restrictions that we've had during the pandemic. We have the Police, Crime, Courts and Justice sentencing bill, which not only gives the police more powers to stop and search, and you're 19 times more likely to be stopped and searched if you're Black, and that's likely to get worse. Not only does it make trespass a criminal offence, which means you can now go to jail for being a Gypsy Roma traveller person who is not allowed to park up anywhere in England, and then will become a criminal for doing so and will have their home confiscated. Not only does it increase sentencing to ludicrous amounts, so if you topple a statue, the maximum sentence is 10 years jail, which is double the sentence for violence towards women. And you just think you can see the priorities that this government have in terms of what they're doing. But crucially, the big proposals in it is to criminalise protest. And they're looking to make it, if you do a protest that's too noisy, it will be unlawful and you can face prison, 2, 3, 4 years prison for having a protest that's too noisy. If you annoy or upset people, it will become a crime. And to be honest, I've never met a manager that's ever not been annoyed when we've organised any of the protests that we've organised at work, or the police or the government when we've organised them in the community. Any protest that has an impact has the potential to be unlawful. So you just think, and they can, a criminal protest of one person can become criminal and you can go to jail. And you just think the extent to which they want to stop us is absolutely massive. And so we've seen sort of, you know, that sort of them using some of what they were doing. It was referred to in the introduction, but in March, they announced a 1% pay rise for health workers. So we got nothing last year and 1% this year. And at the time, we were in quite a severe lockdown where we were in the middle of our second wave. The hospitals were absolutely full. We were at some point running out of oxygen. We were so sort of, you know, under-resourced in the health service that we have it. But health workers felt, unless we stand up and say, if we don't do something about change change the health service, and this government is doing nothing to indicate that it was. We have 100,000 vacancies prior to COVID. We'll have 200,000 and a waiting list of 5 million to deal with, and no one will ever get healthcare again. We have to stand up and stop the government doing what they're doing. So we organised a protest. We risk assessed it. We used the growing evidence that it's not possible to transmit through the air outside as long as you have some distance. We put markers down on the floor, the little football sort of circles down on the floor to mark where people could stand. It was strictly stewarded, and we got people to put their arms out and twirl, and if you can touch somebody that you don't live with, then you're too far away. We had a megaphone to enforce that consistently, but the police decided that that was unsafe, and they fined me £10,000 for organising that protest. Somebody calculated, had I used my 1% pay rise to pay that fine, it would take me 56 years to pay that fine off. And that you can see the impact of such a huge fine has as a deterrent to ordinary working class people to fight back. Fortunately, the population of Britain is very good, and somebody put out a GoFundMe, and within a few hours we'd fundraised double the amount that I needed to pay it back. But I'm not paying it anyway. We're taking them to the High Court for a judicial review, and I will fight them to the end to stop them enforcing that fine. And there's a good chance that we will win that in court. But it isn't. I didn't get the fine because it was unsafe. The very next day, they were reopening schools, and there would be crowds 10 times bigger outside every school that weren't wearing masks, that weren't socially distanced, that didn't have any of the stewarding that I had. And they didn't worry about that. They didn't worry about the 24 million people who'd been going into work and working in unsafe sort of enclosed spaces where we were getting more and more of the super spreading events. They weren't worried about any of that. So it isn't because it was unsafe. It was because we were putting the government under pressure. The problem is that a £10,000 fine does deter people, and therefore our right to protest is something that we're fighting for. It's interesting. People may know Dominic Cummings. He's one of the chief advisors to Boris Johnson, who's since been sacked because they've fallen out, who was one of the drivers behind their terrible policies. If he had COVID and he travelled 300 miles up to his parents' second home in order to be cared for while he and his wife was unwell, completely outside the rules. Had he had that fine, it would have been a few months of his pay rise. And that's the difference between us and them. The next week after I was fined, a woman had been murdered. A police officer from the London Police was charged. Women wanted to protest, both in order as a vigil to remember Sarah Everard, the woman who'd been murdered, but also to protest about the ongoing threat of violence to women. The police banned the protest. Women went ahead anyway and did protest. And the Metropolitan Police, the same force that the murderer came from, then attacked that demonstration, right? And there were awful pictures on the television of that police force sitting on top of women, hitting them, attacking them, and fining them under the COVID law. And what that led to is a huge wave of protests where people said we cannot allow them to stop them. We can't allow them to back down on this. We were complacent when they brought in anti-trade union laws, and unfortunately most of our trade unions have gone along with those trade union laws, and that just entrenches them in place. Because we did then protest in large numbers, even though there was no right to protest according to the police at that point. They then, by the end of March, had lifted the restrictions on protest, and there are now legal sort of ways for us to protest. And I think that's a lesson for us. If they say you can't protest, the way to stop it is to defy those protests and protest anyway. You have to do it safely. I'm not in favour of unsafe protests, but safe protests, risk assessed, stewarded, out in the public is the way to hold our governments to account. It builds people's confidence, and it allows people to articulate and begin to change the world. And I think the history shows we never get anything by asking for it. We only ever get anything when we fight for it, whether it's going back to the sort of 1900s and the Taff Vale workers who fought for the right to picket when it was unlawful by picketing and by going out on strike, or the poll tax that we didn't pay and we went out and demonstrated about. protesting brings us together collectively, something we've really struggled to do in the last year and a half while life has been so horrible. It's essential that we find ways to do it. And the more you do that, the more you push back on that government.
Thank you. Thank you so much, Karen. Our next speaker will be Kostas Katarachias, who's a doctor at a cancer hospital in Athens. So Kostas, over to you.
Thank you very much for the invitation. I want to send my solidarity to Karen and all this battle they had there. It is very inspiring for our struggle to participate in your online meeting about the pandemic and the fight during a very difficult period, which, however, carries so many opportunities for the working class. To begin with, the current pandemic wave is nothing but finished. While the weapon of vaccines will not be effective enough to restrict the virus to endemic waves. The reason is that the vaccines are not available for the biggest parts of the world population, and that vaccine nationalism combined with competitions for profits are effectively destroying this breakthrough. In Greece, the conservative government of New Democracy with Prime Minister Mitsotakis for more than 1 year, almost 14 months, has been an absolute disaster with regards to managing the pandemic. For more than 2 months now, we are facing the worst escalation in the numbers of new infections and of patients who need hospitalization in ICU. The daily deaths per million are among the world's highest rates now, and we have about 11,000 deaths from the beginning of the pandemic. Our population is almost 11 million. The government, for more than 14 months, did not do anything to avoid this catastrophe that we are witnessing now. No mass recruitments of healthcare staff, no important increase of hospital funding and ICU beds. The vacancies in staff were more than 40,000. We had only 570 ICU beds, as the mean European number demands for the population in Greece more than 2,500. And until now, we only have 800. Very low numbers of tests, no intention of strengthening the dilapidated primary healthcare system, nor acquisition of private hospitals. In contrast, they converted big hospitals to COVID-19 monitoring units, thus leaving poor people trying to survive other illness in despair. During the last year, we recorded more than 5,000 non-COVID-19 related deaths as compared to the year before that. Nothing was spent for the protection of high-risk groups such as old people in nursing homes, the working class in big industries and crowded working places. And of course, no budget increase was ever designated for public transport. All this period, they eagerly increased funding for the capitalist airline companies, the mass media, private clinics, the tourist industry. At the same time, however, poverty and unemployment surged. Funds for the public healthcare system were declining, with the only measures by this dangerous government being a useless lockdown, one of the longest and harshest worldwide. A lockdown imposed only on the working class and the poor, with curfews and restrictions of their leisure. Moreover, the government used the lockdown and the fear of the pandemic to repress civil rights, give power to the police, ban demonstrations in an effort to isolate the left and the movement. And they failed. The resistance did not stop during the pandemic and the lockdown. On the 7th of April in 2020, last year, The workers in the hospitals organized congregations in every hospital after the initiative of unions controlled by the anti-capitalist left, like Agios Savvas, where I have been, my hospital, where I have been president in this union for more than 8 years. So the message to all the left was that we can have struggles. We can have struggles, and the escalation of the strikes in hospitals is the only way to save lives, demanding mass recruitments, permanent jobs for hitherto short-term staff like I was, test and personal protective equipment for safety in the working places. Every week, every month, all this year, the strikes of the hospitals were the meeting point of the working class expressing their hatred for this government. Outside the hospital, there were many gatherings. The strike movement was spread to the tourists after the last last spring, was spread to the tourist industry in workers, the art workers, the teachers during the last summer and the autumn. On the 7th of October, the huge anti-fascist demonstration outside the court led to the conviction of Golden Dawn Nazis as a criminal organization, showing to all the left that we can win, even under seemingly difficult circumstances. And I would say that this demonstration was very huge. It was more than tens of thousands of people gathering all the day. And after this, there was no change for the infection wave. There was no difference after this. That is a proof that the demonstration don't contribute to the spread of the coronavirus. After this victory, the anti-racist movement emerged stronger against the government's racist policies, with long-lasting campaigns for open borders and open cities for the refugees, healthcare for all, and vaccines for the immigrants and asylum seekers. That's why 20th of March was a great demonstration which echoed the world anti-racist movement's demands. On the 17th of November, the government banned the commemoration demonstrations for the uprising against the 1974 coup in the Polytechnic University. That was a big provocation to the anti-capitalist left and all the left people in Greece. After the initiative of our party, Revolutionary Party SEC, SWP Greece, and the anti-capitalist left to ignore this ban, there was a big united front of all the left to defend the right to demonstrate. Despite clashes with the riot police, the demos eventually took place in the center of Athens and all the major cities of Greece. That was a crucial turning point where the government began being all the more isolated. Then we had the Greek Me Too scandal with officials of Conservative Party, artistic directors in theaters and sports tycoons involved in sexual harassments and rapes of young women and men. The rage against the government was escalating, so the 8th of March, the strike for women's rights was another uprising with the unions spearheading this battle. It was a big strike demonstration this day in Athens. So all this situation with the courageous initiatives of our revolutionary party radicalized people. When the riot police tried to restrict people inside their homes this March, they assaulted on a youngster at the local square of a suburb of Athens, and the video of this police brutality incident went viral, thus transforming the rage to a big explosion of demonstrations in this suburb. In response, the government couldn't afford but to withdraw police forces from the neighborhood, and that was another victory for us. In March, we have the statistics said that we have more than 600 demonstrations taking place in Athens. The government knew that in the core of this resistance was the anti-capitalist left and the unions controlled or influenced by SEC, our party, and our initiatives, like the coordination of hospital unions created by Agios Savvas for years. For example, in autumn, we organized demonstrations and strikes at my hospital, which is the biggest cancer treatment hospital in Greece, for 2 months in a row against the unit's disastrous management, which result in the uncontrollable spread of coronavirus infections among staff and patients. There was a big publicity to this, and it was clearly revealed how little the government cared for the healthcare workers and the patients themselves. That was a big blow to them. It shouldn't come as a surprise that I was targeted due to my syndicalism action, organizing strikes all these previous years that ridiculed the government and all this management. And the Ministry of Health began a prosecution against me and my role as the union's president. I had been working as a doctor in this hospital for 5 years with short-term contracts, and they tried to get rid of me with clear intention to dissolve our union. There was a huge battle against them for more than 2 months, which united all the left and all the unions nationwide, with big strikes and demonstrations called by the public sector unions, and the solidarity was astonishing. The issue was even brought to Parliament, and several conflicts about my case took place among right-wingers, MPs, and all the left. At the same time, there were demonstrations in solidarity in Italy and Germany. On the 30th of March, my last day at work, we organized a big militant demonstration toward the Ministry of Health, where we clashed with the riot police, who had the nerve to hit nurses and doctors. The rage after was huge. Ultimately, the government was defeated, and I returned to the national healthcare system as a permanent staff. The victory was so big that thousands of people celebrated, acknowledging that we are fighting with our unions for the health of the many, and that the unions must be defended. During the year of pandemic, young workers and new segments of working class massively organized in unions, with the actors being a telling example, or even created new unions. This tendency made unions stronger as they emerged as the only real alternative in everyday life against this government. The hospital unions were pioneers in organizing the fight back in this crucial sector for the pandemic, and Agios Savvas, my hospital, was the core of this movement. On 22 of April, after championing the right to have the unions we had a new successful strike across the healthcare sector. Last Thursday, we had a big general strike in 6th of May. That was the May Day strike, because 1st of May overlapped with Easter. with confidence after this strike that their plans to attack our unions and 8-hour day will fail as well. We can get rid of this disastrous government depending on the labor movement and the demands we have, because it is up to us, the working class, to create a getaway from barbarism. After 1 year, we can say that we are more confident, more stronger, and the government is weaker. Thank you very much.
Thank you, Kostas. That was great. Okay, our final speaker will be Sung-lim Kang, sorry, who is a public health worker in Toronto. Sung-lim?
Hi, thank you, Felin. Thank you, Karen, and then Kostas is really inspiring. You guys' story. When I was first asked by Michelle to speak with you guys, like Karen and Kostas, I was a little bit shy because I didn't really have any story to share to inspire people. Now I'm really inspired by you guys' story, and then I can replicate your initiative in the coming struggles. Thank you again, Karen, and then Kostas. I'm just gonna give you some situation before pandemic, after, during pandemic right now, in terms of in our local situation, like Ontario, like Toronto, Canada. So in terms of before pandemic hits, the conservative Doug Ford government came into power 2019, and then they announced one of the first things they want to do is restructuring and then massive cuts to healthcare systems, which including cutting provincial funding for public health by 1/3, 30%, and then reducing public health units from 35 units to 10 units, which people sometimes don't know what local public health unit do. They provide very vital local services such as food and then water safety and then infectious diseases tracking and prevention. Before it becoming outbreak, we prevent and then we control infectious diseases and the immunization and needle change and so on. So fresh in our memory, what happened exactly 21 years ago, in Ontario, Walkerton is a small town. At least 7 people died from the drinking contaminated water, which was the worst public health disaster in Canadian history. And then there are lots of people, became sick, drinking contaminated water with E. coli. There was a directly result of Mike Harris, at the time conservative government, cuts to the public service. Even though the memory was very fresh, this government, conservative, the same government came in to do the same thing, exactly the same thing. So also we all aware of restructuring in healthcare system usually means taking billions public money away from services and then laying off healthcare workers and then privatization. So people have to, pay for the medical services. So at the time, 2019, when these things announced, there are massive rallies and protests against these draconian cuts. Because of the pandemic right now, this plan is been put on hold. But last year, the Doug Ford government still says we're gonna push through this plan. So also we have to remember to understand what's going on right now in terms of Doug Ford government response to this pandemic. We have to also remember this government is the one canceled 2 paid sick days, which was enacted by previous Liberal government, like granted 2 sick days for all workers in Ontario. But he came into power and then he canceled one of the first things. So given this kind of his agenda, it's not really surprising at all when we see this government awfully inadequate response to the pandemic. So I'm gonna just give you 2 examples because I work for the local health unit. I am my part of job is follow up COVID cases and then contact follow up. So Doug Ford, he's a premier in Ontario. He refused to grant 10 paid sick days to curb the transmission of COVID infection in workplaces. Right now, we are going through in the so-called the 3rd wave in Ontario. There are lots of outbreaks happening in workplaces. That's why many organizations, community organizations, labor organizations, and then even his own government expert called for the 10 days, paid sick days. But he was dragging his feet, and then finally he came out saying, we're gonna give you 3 paid sick days, which is even not permanent, it's just temporary until September. And then meanwhile, his government gives big corporations such as Rogers Communications, he's a big communication company in Canada, as well as a big chain supermarket Loblaws, and then Amazon's give you billions subsidies. And then also instead of dealing with this outbreak, workplace outbreaks, which accounted for 2/3 of outbreaks in community, he adopted as control measures, as infection control measures, such as giving really sweeping power to police so that they can call the people, they can stop people, where are you going? They can ask many invasive questions. And we all know these kind of things lead to the affect disproportionately people of color, immigrants. And then also he, instead of dealing with the real cause of the infection, he's banning the outdoor activities, even exercising outside, and then and then closing playground. So some of these measures dropped in the face of severe criticism from the public and then medical community. This is so ineffective measures. So he dropped some these measures, but still there are things it's not really help to cover transmission. Also last week we had the blistering long-term care commission's report came out. In Ontario, we have seen during the pandemic 4,000 long-term care residents died. Not because of simply virus was deadly, that's why they died, just because they died because of deadly condition where these elderly people crowding, overcrowding, and then there is no enough space to put them apart, and then there is no infection control measures in place to prepare for this kind of pandemic. Also basically chronic shortage of staff, they just hire agency people temporarily, and the agency people go around many places and they provide services. So it was not just like unfortunate, like just to like, oh, well, it's really unfortunate. It was really like, a disaster in waiting all along, because these places, long-term care homes, like run by profit-driven private sectors, and then otherwise like, very murderously, like chronically, like underfunded, like local government. So it was not really surprising at all, like to see this like a high number of deaths in long-term care homes. So in response to this commission's report, they double down. They just like blamed like previous government, and then they don't even address like what they're gonna do. They said that they're gonna do better to correct situations, but they never indicate they're gonna change the direction, like no more privatization, like more regulations, more like funding. So they don't really announced. So yeah, and then also this, at the beginning of the pandemic, like COVID virus might be the equal opportunity, but as it turns out, that was not the case. Really, like race and then class position was the like two main, determinant of factors of like who will get the virus. So this pandemic has sharply exposed how capitalism, puts profit before people, as we have seen, like essential workers, like people, like delivery people working at a supermarket, they don't really have any paid sick days. They have to go to work even though they are sick, because they get their like pay cut. That's why they go like go to in sick, and then no PPE provided, and also the government and then the business treat essential workers as if they are just collateral damage. Just it's the way things are. Just it's inevitable. And then when we see also like vaccine disparity among between the global south and the global north, and then also like schooling over like AstraZeneca's like vaccine between EU countries and then Britain, we cannot, under this system, like this kind of crisis cannot be solved. There is no rational planning, like as if we like close down the border, we're gonna be safe. But that was not the case. Like expert, we already knew, but they just turn away from the like real solution, and then they just like provide very like temporary, very ineffective like solutions, like closing down like borders. The longer the pandemic continues, there is a more possibility to have like new and then emerging like dangerous variant to be selected, and then it's gonna coming again, and then the vaccine we are getting might be effective at all. So we need some international and rational planning to tackle this crisis, but there is nothing this system provided for us. So I guess like this pandemic, this virus call for the like a real alternative, like a different world, like to deal with like enormous like issues, climate crisis, and then this pandemic. So hopefully during discussion, people can give us more like local struggles they are involved in, so that we can generalize our experience, and then moving forward. I think we are people are really angry, frustrated. So I guess sometimes it's a matter of organizing that anger into some like activities, like strike, industrial like actions, and then also Karen and then Kostas also created that fact, yeah, during even though this kind of difficult times, people can fight and the people can defy, so that we can have a better chance in the coming days. Thank you.
Thank you, Sung-lim. Thanks to all our speakers. That was really, those were incredible presentations. So we're going to move